Welcome to the 5-Second Rule podcast. We are your hosts. I'm Kelly Holmes, and my preferred pronouns are she, her.
And I'm Lerenza Howard, and my preferred pronouns are also she, her.
Today, we're diving into something exciting from APIC, the Center for Research, Practice, and Innovation, and its brand new APIC Research Network. And I'm pleased to introduce our first guest, Becca Crapanzano-Sigafoos. Becca is the Executive Director of the Association for Professionals in Infection Control and Prevention, or APIC as we all know it and love it, Center for Research, Practice, and Innovation. She received both her BS in Public Health, Health Education, and her MPH in Epidemiology from East Tennessee State University. She completed her doctorate in Public Health in 2021. She has been CIC certified since 2008 and is an APIC Fellow. Most notably, and a fact I love, is that Becca is a mother of 6 amazing daughters, ages 11 to 28. Welcome, Becca.
Thank you. Glad to be here.
And I have the amazing honor of introducing to you Sara Reese, who's the Director of Research at APIC's Center for Research, Practice, and Innovation, with extensive experience in infection prevention leadership across major healthcare systems, including Intermountain Health, Swedish Medical Center, and Denver Health. She has led pandemic response efforts, driven healthcare-associated infection reduction initiatives, and contributed to the field through mentorship, publications, and national conference presentations. She received her Bachelor's of Science and PhD in microbiology at Colorado State University and her Master in Public Health at Colorado State of Public Health. In her spare time, she tries to keep up with her 14 and 10-year-old boys. Sara, welcome to the show.
Thank you. So happy to be here.
Thanks for joining us, ladies, and we'll just jump right in. So for our listeners who may not be familiar yet, could you give us a snapshot of APIC's Center for Research, Practice, and Innovation and the role that it plays?
Absolutely. Super excited to talk about the CRPI, as we know it for short. The center was created back in 2022 with the goal of developing a clear pathway from the generation of evidence through the dissemination of best practice and practice guidelines. So CRPI is broken down into a couple of distinct areas, with research being one of the primary areas, including the Research Advisory Panel and the APIC Research Network, which I'm hopeful we'll get to talk more about today. And then the practice guidance side, which includes the Practice Guidance Committee, the Health Equity Committee, our Emerging Infectious Diseases Task Force. And then we also have oversight to facilitate the APIC Corporate Directors Council, which we lovingly refer to as ACDC.
Oh, I love that. Rock on.
Yeah,
Absolutely. And so over the past year and a half, the research aspect of CRPI has been really busy. We released in later half of 2024 the APIC research agenda, which there's a lot of information that went into kind of what are our research priorities for the next 10 years. And we also released the hand hygiene study earlier this year. And so we are looking at the number of observations that an infection preventionist could collect to really determine the hand hygiene adherence on a unit and compared it to what regulations and national guidelines are. So that was a super fun and exciting study. We also did a large IP retention study. So we evaluated what are factors that organizations and leaders can offer for an IP to make them more likely to stay in a role, and really found that IPs want job flexibility, and work from home options are kind of the biggest aspect, along with career opportunities and advancement. And then we also, over the summer, we released the APIC Mega Survey. So every 5 years, we release our giant mega survey that really evaluates infection prevention environment, the workplace environment. And we released it in 2015 and 2020, and then just June of 2025, and had almost 5,000 respondents, which was really exciting to have that many people participate, and are in the process of analyzing all of that data. My favorite thing to do.
And yeah, as a fellow researcher, I'm excited at 5,000 responses, and I look forward to what comes out of the mega survey. So, of course, when I saw in correspondence related to the APIC Research Network, as a researcher, that definitely piqued my interest, right? As this is a brand new initiative that was implemented this year. So, Becca, share some insights on the network and its structure.
Absolutely. So, I think back about APIC 2024, Sarah and I were sitting at a table in the staff break room, just brainstorming near the end of conference with our brains completely full of all of the things we had learned that year, brainstorming this mission that the APIC board had given us to do a number of things, but to do them succinctly. So partner new researchers or folks that are interested in research but don't have any experience with mentors, and facilitate infection preventionist driven and informed research, and create a collaborative research environment so that researchers from different organizations could collaborate together to really broaden the scope of the different work in our field. And I think we both kind of had that bright light moment of why not build a research network, and not just a traditional research network, but one that has different levels of membership. So individual level membership for infection preventionists who are either interested in learning new things about research or mentoring others. Our individual membership has a number of levels. We use belts as our levels. So think white belt, green belt, black belt. And folks come in as a white belt with either very little or no knowledge at all about how to conduct research. And we provide them with educational materials in the form of webinars and relatively short sort of micro learnings to help get them up to speed on the basics. And then the next level being green belt with additional, more in-depth webinars and learning opportunities. And ultimately, we will have education sessions to help folks move from that black belt expert level in research to the mentor level as well. So that's one component, an exciting component. The other is organizational membership. And that allows organizations to join and to benefit from the same resources that individuals could benefit from, and be able to have access to their colleagues, to collaborate on surveys or other types of studies. And for both groups, individuals and organizations, to be able to benefit from the expertise of our research advisory panel, which is a group of 11 senior level researchers that help to serve in that advisory capacity for the work that the APIC Research Network does. Sarah, did I forget anything important about structure of the research network?
I don't think so. I think it's fun to point out also that since we've launched it in June, we have over 300 members that have joined, and we have over 30 mentors and black belts. So I think we're building a very strong network, and we're hoping that more and more people will join.
There's our data girl. She loves those spreadsheets.
Absolutely. And that's so interesting to know, especially the various layers or membership and belt types for this, because that's my next question is, of course, some of us know that there are other research networks, including SHE, that exist. So explain to listeners how exactly, or describe it, how exactly does the APIC Research Network differ from other research or practice networks, and what kinds of projects do you envision the APIC Research Network supporting?
Sure. Yeah, I think, what makes our network unique in comparison with the SHE network is SHE is focused on organizations, and this individual level membership made the most sense for APIC because so many of our members have not had an opportunity to really dip their toes into the water of research, right? And so having just an organizational based membership for our network didn't make sense, because we have a lot of work to do to get IPs in general to the place where folks are feeling confident being able to publish in peer reviewed journals, be able to submit abstracts and conference presentations and that sort of thing. So I think ultimately this work is intended to drive our profession forward and further faster. And so having that dual type membership focused on the individual and the group makes sense.
Sara, any thoughts from you?
Yeah, and I think in regards to the kind of projects we envision the APIC Research Network supporting are going to be kind of multifaceted, really. We're going to offer the traditional network survey type studies where if you have a survey and you want to survey a handful of IPs, you can set it out to the network and get your responses. But then I think we're also going to be able to offer multi-facility studies. You have a project that worked really well in your hospital and you want to expand it to other hospitals and see if it works in a different setting. We'll have that opportunity, as well as an IP that's one IP in a hospital and they have a QI project, quality improvement project that they really want to work on but just don't know where to start. We have those in the one facility studies that we'll be able to support them through. So I think the opportunity that we have with this APIC Research Network is huge with the variety of studies that are going to be able to come through here.
And one other really exciting thing is APIC Research Network members are able to submit proposals for the use of our mega survey data so that if they want to do a project that takes advantage of that data set, that following our advisory panel review, they'll be able to have access to portions or potentially all of the data set, depending on what their project looks like. So that's a new resource, and I think one that makes membership potentially even more exciting to folks.
I'm pretty sure many stakeholders will definitely state, at least I know I would share that fills a gap within the profession, just having that intra-facility collaboration on research that is underway. So with that being said, of course, IPs are very busy within our daily work. So as it looks, tell us what it looks like what are the requirements to join? And then what is the time that IPs would dedicate towards participation if they're interested in ARN?
Yeah, so we wanted to make this as easy as possible to join because we know that IPs are very busy. We understand that and are very sensitive to that. So joining, first of all, is totally free if you're an APIC member. So that makes it easy and affordable. And then also in order to join, they should go to the APIC website and go into the research tab. The APIC Research Network is there, and you click and you just fill out a brief application expressing your interest and basically getting our understanding of what your experience with research. Have you published any papers? Have you done any presentations? And you don't have to at all have any of this, but we just want to know where to put you with the belts. And then once you complete that, and it's very, very brief, you will get a link to complete a self-assessment. It seems long, but really it's just assessing where you are more kind of stronger in aspects and where you have opportunity to grow. And so it just gives us an idea as an IP where your strengths are and where your interests are for upcoming research opportunities. So super quick and easy. And then once you fill out that self-assessment, you get a letter that says, welcome to the APIC Research Network. We've given you this belt. And by having a white belt or green belt, you have access to these education courses and the online community. And as for participation in the actual network, we really just require that once a year you participate in a survey, and then one survey that's gone out or a project that's gone out, so we know that you're still an active member. And that's really all that we require of you, but just definitely highly encouraged to capitalize on all the mentorship and education opportunities that you have and ability to move up in belt if you come in as a white belt or a green belt or even a black belt.
Oh, thank you, Sara. And hopefully after people listen to this podcast, you're going to see that network hopefully grow and grow and grow. There's so many great resources that are available, and it really helps paint a picture of how easy it is to get involved. And so you had mentioned earlier about APIC's research agenda, and I know that was released last fall. Could you share some details with us on the agenda and how you plan for it to be incorporated into the APIC Research Network?
Yeah, absolutely. So the research agenda was really the first activity that our department conducted once we came together. And it was a partnership to really try and understand where are the biggest gaps in infection prevention and control practice. As we sort of determine those through surveys of our membership and started to break them down, we realized that there were things that are within our scope as APIC, as infection preventionists, to conduct research on. And there are things that are outside of our scope that we need to share with our partners, others in the healthcare community that would be more appropriate to take on that type of research. And so the research agenda is broken down into those two groups. For those areas that are seen within scope of APIC or infection preventionists, it's really helping us to prioritize our work. So the things that Sara has talked about, burnout, attrition, retention, et cetera, these are all areas that we heard from our colleagues in infection prevention that they felt were priority areas. And so that's been sort of guiding and leading our work. Another area that is included in the research agenda that you'll see more of in 2026 is looking at return on investment and the value of infection prevention programs overall. So excited to talk more about that work as well.
Oh, that's really interesting I love that you're using that member feedback to drive the work. And then I think you kind of already answered my next question, which was, did you want to highlight any kind of exciting initiatives or impactful research that you currently have underway? Was there anything else that you wanted to mention in these early days of the research network and what your focus is on?
Yeah, absolutely. I think that topic in particular that I just mentioned, the value of infection prevention programs, is something that I think right now is a real focus, just given the fact that organizations are cutting back. It's difficult to continue to justify the need for all sorts of things in healthcare given the deficits in funding. And so we understand that in order to support our members, it will be important that we provide them with tools around not only the work we did with the staffing calculator, being able to estimate and understand what your staffing should look like, but being able to speak in a way that our various C-suites can hear and understand about what makes infection prevention programs valuable, not only how we impact things like PAC penalties and direct cost associated with HAIs, but things like length of stay and turnaround time and readmissions, that there's a component that exists that infection prevention programs impact to all of those things. But that literature has never really been reviewed and put together in a way that makes it easy to access and easy to understand and cite. And so our goal this year is to really understand more about the research that's been conducted in that area, potentially add to the research, and then ultimately be able to provide a calculator of some sort that makes it very easy to be able to share with your C-suite, your CFO, et cetera, how your program is impacting your larger facility operations.
Yes, Becca, and I know I can attest that I've utilized the staffing calculator. So I appreciate you and all that were involved in building and growing that tool, because I know that will be something that's very useful for IP stakeholders. Sara, do you have anything that you want to add?
Nothing additional. No, Becca covered it all on that one.
Thank you. I wanted to go back, Becca, because I know you hit a point noting the deficit in funding, and I wanted to unpack that because I'm pretty sure my next question kind of provides an overview, or at least goes into depth about the current matters of today and the things that current updates within our world of today. So given the evolving national landscape around public health, including reductions in infrastructure, the limitations on research funding, along with shifts in policy, how can infection preventionists continue to advocate for evidence-based practice and protect vulnerable populations amid these challenges?
Mm-hmm. Yeah, absolutely. I think it's a little bit of a frightening time for folks where there is so much change happening right now, and it's not necessarily clear as to how that is going to impact us and our programs in the long term. I think that grant funding is something that we've depended on for research for a very long time. And that tends to be that sort of what I like to refer to as big R research, right? Like research that's often conducted through universities or university programs versus the kind of research that infection preventionists do and maybe often don't realize that they're doing. And that's the the day-to-day performance improvement projects that ultimately have significant results and have learnings that are potentially really important and impactful for us to share within our communities. And so I think that we're at a time where we need to focus more on how do we identify those performance improvement opportunities that we know we're already going to conduct internally within our organizations. How do we ensure that we are developing the strategies in such a way that they utilize rigorous methodology, and then ensuring that we share them. We submit them as abstracts or publications, manuscripts to peer-reviewed journals, et cetera, and continue to have information flow in a time where we might not be seeing as many of these sort of large grant-funded studies.
Mm-hmm. Absolutely.
Yeah, I agree. That's really comforting, Becca. I'm so glad that you made that point, and I hope that people who are listening are comforted by that participation in the research network is not limited to big R funding. And so that is really great to hear for our listeners. I'm curious about how APIC's research network will foster those collaborations that you spoke of, like across disciplines, institutions, and even across our borders, so internationally.
Yeah, internationally, we're definitely excited about the opportunity there. We are opening the APIC Research Network to international APIC members, and so I checked today, we had almost 20 international members, which is super exciting because that will allow us to have opportunity to do research across countries, and it'll be really cool to see how that turns out. Additionally, we're excited because the mega survey was recently adapted for the Australian IPs, and they're going to release an Australian version of the mega survey later this year. And so we're really hopeful that more international partnerships can develop through the network. And then across institutions, as we mentioned, the opportunity to do multi-facility studies. You have that idea with that IP with one great idea that works really well in their ICU, and then to show that it can work in other ICUs across the country is a great opportunity with the research network.
So one of the things that I feel has come up several times within our episodes is the area of opportunity, and the fact that some IPs really don't understand the fact that they're actively doing the research. So I thank you both for sharing that insights, as ARN would definitely be a resource at the individual level for those individuals to seek that mentorship. So thank you for that. I do have some questions related to the advice that you can share for IPs. So what advice would you give to IPs who want to contribute to research but don't know where to start, essentially, from my previous note, and then also include insights as it relates to the lack of resources, maybe rural institutions, even global networks that are in need of resources? Can you share some insights related to that, Sara?
Sure. Yeah. So IPs, they don't realize they're doing many IPs don't realize they're doing research in their day-to-day jobs. And I think when you use the word research, it seems so overwhelming. There's so many different aspects, and the IRB and publications and presentations, and it just seems to be a lot. And really, I think the benefit of the ARN is that it's a great place to start if you're interested in learning more about doing research as an IP. We made it free to join. You have free access to these micro learnings and a more lengthier, detailed research webinar series, so you can learn all about it in your own setting. And you also have this mentorship aspect. And so it really helps you kind of break down all of the steps of doing research as an IP. You start with an idea, and you can get it all the way to publication if you just take the time to learn with a mentor and really walk through it with you. And that's what the ARN can offer. The membership opportunities, we're developing basically where you're paired with a mentor to assist you wherever you are on your research journey. If you need to come up with an idea, if you need help in your methodology, maybe you're working on a survey, wherever you're at with your research project or passion, even just having a passion with it, we will partner you with a mentor that will get you on your way. And that is the beauty of joining the ARN to get you going as a IP who wants to embark on this research journey.
Yeah.
Becca,
absolutely.
what about you?
I mean, did we mention it's free? I feel like I'm not sure we said that. And
I think we should highlight it again. Yeah, it deserves to be said twice.
Right.
The education's free too.
Absolutely. And our goal is really to demystify this world of research and to help folks to feel comfortable taking that first leap. My ex-husband used to tell me back when I first started in infection prevention in 2005, every day as I was leaving for work, he would say, fake it till you make it. Because I always felt like I didn't know what I was doing. And there's a little bit of that as you're starting out into this whole new world with terms and databases you've never had access to or used. And there's so much to learn. And why not learn it with a group of other people that are interested in the same thing, doing the same thing? And yeah, we're hoping to make it a really fun, inclusive environment for folks to take that first step.
That is so encouraging to hear really how approachable research is when you have that right support, and you all are painting this picture to make it sound like a very warm hug. So it's very encouraging to hear. And I think you've touched on this a little bit, but to really bring it home for our listeners that are like, is this right for me? Or what if I make a mistake? Or what misconception about infection prevention research would you like to just blow out of the water right now?
It's not nearly as scary as people seem to think it is. And it doesn't take as much time as people think it is. It does take a little extra time, but really it's not as overwhelming once you start breaking it down into individual pieces. And I think having something like the ARN out there to help you do your first couple of projects will go so far. Because once you understand what you're doing, like anything in infection prevention, you can do it alone. You need that mentorship. Like our whole field is built on mentorship. So why not have research be built on mentorship as well? Because that's really the ultimate way that we're going to be successful doing this.
Absolutely. And it feels so good the first time you see your name in print in a peer-reviewed journal too, right? You can frame it and brag to everybody in your world. It's a lovely accomplishment and something to be able to add to your CV that I think is really worthwhile.
Oh yeah, and I know that there may be individuals out there that are more so on the introverted side. Definitely reach out to stakeholders, even including the researcher that you admire, that you're reading their research in APIC. There's a plethora of platforms in which you can reach out to those individuals, including LinkedIn. So always take your chance. The only thing that anyone can ever say is no, just to assess whether or not they're interested in being your mentor, and reaching out to other resources as well, including ARN related to that. So I'm curious from you all's purview as far as the future outlook of ARN, right? We see so many initiatives, including AI and its uses within our profession. So looking ahead, how do you see ARN shaping infection prevention practice over, say, for the next 5 to 10 years?
We would love to see a lot more research done by IPs for IPs. A lot of our research is done by academia, which is great. There's definitely the benefit there, but really the IPs that are in the hospitals doing the work, or that's where we really want to see more research done. And we're hoping that ARN can get us there. And we feel that with the ARN mentorship opportunities, we have that.
I totally agree. And I think that I'd really like to see the voice of the IP become louder in the healthcare community as a whole. We publish a lot in our own sort of corner of the universe. And I think it's important for us to broaden if we're publishing on a topic that is potentially useful to other people in other disciplines, that we be thoughtful about where we submit that information. And recently, Sara led a group doing work on retention and attrition and burnout, as she had mentioned. And one of the many articles that they submitted with the findings, the results from that, was to an HR journal, because those are the folks that HR tends to not know very much about infection preventionists and what makes us unique and why you really don't want to let an IP go if you can help it, right? Because we're pretty hard to train and we're pretty hard to retain. And so we want to be thoughtful on that. We want to be thoughtful about encouraging folks to reach out across other healthcare disciplines, submitting abstracts for conference and conference presentations, et cetera, for that same reason. The more multidisciplinary, collaborative we can be, the better ultimately it is for not only our profession, for patients as well.
Will everything be published in AGIC? But then Becca mentioned the benefit of spreading this out to journals for other professional organizations to learn about what we do. So yeah, thank you for making that point.
No, not to say I love AGIC. A lot of what I publish has been published in AGIC.
Oh,
it's
yeah,
a wonderful
absolutely.
journal. It tends to be IPs and folks that are already interested in what we do that read it. So it's a critical resource. But yeah, there's other places out there too.
Sure.
And I think another goal to highlight is how often do you attend the annual conference for APIC and you see a presentation, you think to yourself, I did that 5 years ago. Right. So I think we are often bound by the fact that we've done these projects, but we just don't know how to present them and get them out to the world. And so that's something that we really hope that the ARN can offer for IPs.
Yeah, and to that point, Sara, I definitely had, as I navigated my doctoral journey, I definitely had someone share with me that they regretted not publishing their journal article because the things of today, and including the information that's being disseminated by the Centers for Disease Control and Prevention, was the sheer information that they many years ago did their research on during their PhD program. So definitely get your work out there in a plethora of platforms.
I totally agree. You guys paint such an exciting vision for the future of infection prevention. And I love that this idea was born over a conference table in a break room. And, it's going to grow from here, and it's such a wonderful resource for infection preventionists. So I want to thank you both for your leadership and joining us today. And I'm really excited to see where this goes.
Absolutely. And I wanted to join in and just also express my gratitude to you, Becca and Sara, for the information that you provided. And I would also be interested to see the cross-functionality of how ARN and the work that you and the team are doing and how it will bolster individuals in obtaining the advanced leadership certification in infection prevention as well. So I thank you both.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.